And that reminder tells us that the recording is about to start. Dr. Sam, I would like to welcome you.
Thank you.
Yeah, and before we start, I'm going to share our screen so that people are aware of what we are here for. Right. The topic for our discussion is dispelling the myths surrounding COVID-19 pandemic in the community and staying safe. With us today, we have two of our eminent son and daughter of Greater Nebi. Our discussants, that is Dr. Sam Orach and Dr. Annette Alenyo. And before I go on to introduce Dr. Sam and Dr. Annette Alenyo, I just want to say happy Father's Day to every father attending today in this forum. It's a very important day to recognize all our fathers and those who are fathers as well, for the sacrifices that you're making to raise up children, and also to thank our parents who have raised us up, especially our fathers. So it's happy Father's Day to you. Now, when it comes to introducing Dr. Sam, really, he's a man that doesn't need much introduction, to be honest. Dr. Sam is well known, not only among us, the Alur people in Greater Nebi, in Uganda, but in the world as well when it comes to the field of medicine. And I don't think me trying to introduce him here will do him much justice. But what I can say briefly is that he is a medical doctor with about 38 years of experience in the health sector. That includes 30 years in health leadership and management positions, which is the position he's holding currently as Executive Secretary of Uganda Catholic Medical Bureau. Basically, he's the chief executive, so to speak. He has a lot of interest in training and experience in corporate governance and has served and still serves on several governing and advisory bodies, both nationally and internationally. And among them, he's also a member of the Health Policy Advisory Committee of the Ministry of Health and the Board of Directors of the National Medical Stores. He's a member of the Institute of Corporate Governance of Uganda. He was born and raised in Nebi, of course. Besides working and starting and transforming Nyapea into what it is today, Nyapea Hospital, which he started in 1987, up to 2001. He has served as the the Director of Health Services for Nebi, now called DHOs, for Nebi from 2001 to 2004, before retiring from civil service. It's actually hard to imagine that Dr. Sam has retired because he's very active in whatever he does. So thank you for your service, sir. And you're very welcome for today's discussion.
Thank you.
And our next discussant is Dr. Annette Alenyo. And Dr. Annette Alenyo is an emergency physician and a technical advisor on medical and emergency medical services at the Ministry of Health. She's actually at the forefront of handling the COVID-19 pandemic, both as advisory level and as a participant and a volunteer at Mulago Hospital. So she's really a frontline worker as far as this is concerned. I would be very, very interested in what she has to say, because she has firsthand experience in handling this condition. So we should pay keen attention to that. Dr. Annette, I will leave you to talk about the technical aspect of your role in this pandemic yourselves, because I won't be able to do it justice. Right. Our discussion is going to take twofold. The first one is going to be some brief presentations from both Dr. Sam and Dr. Annette. Then after that, we'll open it up to the general public, that is those who are online right now, to throw in your views, throw in your opinions, throw in your fears, and throw in your experiences as well. And Dr. Sam and Dr. Annette will guide us on what is supposed to be the way forward. So Dr. Sam, between you and Dr. Annette, I would imagine you're already prepared. I would say, take it on from here.
Thank you very much, Dr. Jaburu. We are all delighted to be here. When I look at the names of the people who have logged on, it gives me the impression that people have logged on beyond the greater Navy, quite far away as well, which I think is quite exciting. I would like to request members that for the sake of everybody following well, who are not talking, I'm sorry, moderator, I'm taking up, we are all talking to the mute. Like now, somebody is giving us a lot of noise. Please kindly let us mute when we are not talking. It's possible we may also put off our cameras. I might put on my camera just briefly for people who don't know me, just for 1 minute only, and that's what I look like. Apart from what you saw on the introductory slide. Between Annette and I, we have one presentation, which we both of us own. So it is our presentation together. But before Dr. Annette comes in to make the presentation, I just want to make a few remarks. The first question is, why are we having this moment? Why are we having this presentation and the discussion? We all know what we are going through now, the pandemic. And basically, there are three things that are making us have this discussion or this presentation. First of all, we realize that...
I want to write my name. I'm not seeing where I am. Where's the mute? You're there.
Could we please
So
mute ourselves?
I don't know the right name. That's what I was trying to show you. I know how to do it by now. It's this one here. So when I do...
I'm sorry about that.
Being on...
Can we please mute ourselves?
Thank you. There are basically three reasons why we are here this evening. The first is that we realize that this epidemic that we are fighting is evolving. It is evolving in nature, and there is better understanding of the epidemic from the time it started. It's an epidemic caused by a new virus, that I'll tell you later on. It's a new virus that we did not have before, and therefore anything new is understood over a period of time. And so, anyway, Odongo Emilio, can you mute, please?
Can you mute, please, Odongo Emilio?
Patrick Odongo Emilio, can you mute? Patrick Ochung, please, kindly.
Eric, you please mute. Eric.
The host has the option to mute everybody.
Somebody using Infinix Smart 5, please, can you mute?
Infinite Max 5. Can you please mute?
Can't the host please mute everyone else? Just mute everybody.
Right.
The host.
Dr. Jaburu, if it is possible, you mute everybody. I will unmute myself when presenting.
Yeah,
because I'm in trouble with how to mute themselves. So I was saying that there's better understanding with... there's better understanding of the pandemic as time goes, and therefore we need to share so that we also update our own understanding of the pandemic. And with that better understanding, there is newer information. This newer information that we get should not be taken as contradiction of what we knew before, because there are people who get new information. They say, hey, after all.
Dr. Sam, you can unmute yourself. I've muted everybody.
Okay. I was saying that new information, the new information should not be taken as contradictions because people say the health professionals are confusing us. They used to say this, now they're saying this, but this is a new virus, a new disease that is being understood gradually, and with that come new information that we need to share. Number two, control of this disease and many others requires multi-sectoral approach, multi-sectoral participation. So we need to get everybody from the different sectors, from the different corners onto the board to participate in this. And again, as I said about information, we need correctness in information, completeness, timeliness, and the right channel for information, and also appropriateness of information. There's a lot of inappropriate information going on. Information.
Sorry, Dr. Sam, can I just stop you for a minute? Can everybody please turn off their cameras? It's affecting the bandwidth of the internet. If you could just turn off your camera. If you need your camera on, if you want to talk, you can turn it on. Then you can talk. Carry on, Dr. Sam.
Thank you. Information might be correct, but inappropriate for a certain target group. All of you might know that in every profession, there is a strategic level where you can argue, you can discuss, and so on. But the information you pass downwards now for operations are straight. Unless you give them some other information, they go now with that information to carry out the operations. We see in the process of this pandemic, people who are at operational level or even who are outside the operational field completely tend to assume the strategic level where they should argue and they should shape the decisions themselves. And sometimes people who are at strategic level coming down to discuss strategic things at operational levels. And these are all correct. They cause confusion. They cause, what somebody one time said, uncoordinated troop movement. Information needs to come timely. The right information needs to come timely and through the right channel. So with all these getting mixed up and so on, we thought we need to have once in a while time to share so that we get information and we can ask questions. But before I go further, I want to let people know that right from the introduction that was made about me, I'm not a specialist on COVID-19. I'm not a virologist. I'm a medical doctor by training, but like in all fields, when you train, you begin to specialize and super specialize. And so you heard where I have eventually gone in the field of public health policy and management. But I know one or two things still in the general medicine. And that's why I get quite interested, because in the end, all these things filter back also to the issues of everything must be governed, everything must be managed, everything must have policy on it. And that's where my interest comes in. So with that, I want finally to stress the importance of prevention that we will mention to you. The numbers are soaring up. We are going to show you the numbers you have seen already from the national figures, but even in Nebi district alone, the numbers are soaring up. We have not been able to get data from Pakwach and from Zombo. We would have loved to do so. That would have made it even look better. But we imagine that what we are going to see about Nebi district, and we want to thank the leadership of Nebi district for doing this analysis almost every day and putting out for us. And we have used the latest graphics from the 19th, which is just yesterday, the 19th of June. That's one we have used to show you how they are soaring. And this is overwhelming the health system. So with that, I would like to invite my colleague, Dr. Alenyo, to make our presentation. Thank you.
Talenyo.
All right. Thank you very much, Dr. Sam and Dr. Kennedy. Again, like Dr. Sam, I'll just flash my video just for a few seconds so you can put face to name. There we go. And then Dr. Kennedy, if you allow me, I'd like to project our presentation and go through it.
Sure.
Again, as Dr. Sam has mentioned, COVID is not a new disease. It's something we've seen. However, there's been, in addition to the pandemic itself, there has been an information epidemic that many are calling an infodemic that is distorting the way we are managing the pandemic, both as health workers, but also individually and as community. So I'm hoping through this presentation, we'll be able to dispel some of the myths and together agree on a workable way forward so that we pull out of this second wave. Dr. Kennedy, I'm unable to share a screen.
Right. One sec, let me sort that for you. What is your name? Right, you've been given permission. Can you still can't share?
Yeah, I can't. If you can make me a co-host.
Yeah, that's what I'm gonna do now.
Mm. Okay, perfect.
Is that done?
Yes, it is. Thank you.
All right then.
Here we go. All right, colleagues, so we have quite a number of slides, and for purposes of understanding, we're going to go a bit slow, and then we'll have a discussion at the end. So much as we are going to focus a lot on what's happening in NEBI, we'll also maintain a global evidence, but also national evidence, and also evidence on within NEBI. So the perspective is broad, and but in the end, it all comes up together to give us a way forward. So this presentation is essentially about us staying safe in the pandemic and staying alive, really. It is a presentation with a lot of input from the broader Greater NEBI Health Link, which is a group of health workers that originate from NEBI and work all over Uganda and also outside Uganda. Dr. Sam and I are the fortunate persons making the presentation. So I know that all of us are at different levels of knowledge regarding COVID. So I'm going to take it right from the beginning, and hopefully by the end of the discussion, of the presentation, we are all on the same page. So COVID-19 is actually a disease. It's an infection caused by a virus called the coronavirus. The technical name, which you don't have to remember, is SARS-CoV-2. In December of 2019, I'm sure you all remember, there was a video that went around social media of a young Chinese doctor in a city called Wuhan who was really the whistleblower. Unfortunately, he passed away. And he started saying there's a pneumonia that they are noticing in people in Wuhan that are coming in, and they get very, very low levels of oxygen, and they die quite fast. It is different. It is not behaving like what they've seen. And he was calling on people to investigate this pneumonia. It went on a bit, and many of us, were thinking, well, that is verify in China, and it doesn't concern us. And we all had this. I also had it. I was like, that is something in China. Sometimes they get those flus and they disappear. They never get to Africa. And we all hoped this is what was happening. Unfortunately, this thing spread very, very fast, much faster than anyone really could explain. It was highly infectious. And by March 11th, the WHO declared, in just 3 months, declared it a global pandemic. Again, we were still thinking, this thing is far, it's very far from us, it's not going to come. Lo and behold, barely, just 10 days after WHO declares it, we have our first case in Uganda, March 21st, 2020. Since that time, this pandemic has wreaked havoc in the country. Globally, as of, this is the wrong date. Globally, as of today, this is updated statistics from today from WHO website. There are over 178 million people who have been infected and over 3.86 million deaths. Almost 4 million people have died. In Uganda, as of today, 20th June, our total cases are over 70,000. And we have 626 deaths, which are confirmed by a lab investigation called PCR. There's been a lot of discussion on potentially more deaths, as some people are dying in communities and some people are undocumented. The global fatality rate is 2%, and for Uganda, it's just about almost 1%. So what exactly is COVID? So there's a family of viruses. As we know, we all exist in families. Even in human beings, we have family Jupangade, Jupangage, same thing. There is a family basically Jupa Corona viride. SARS-CoV-2 or Corona, the one we call the Corona COVID virus, which we all know, belongs to that family. They're actually different people in that family, or different viruses, or different types of viruses within that family. 4 of them cause mild coughs, and we never really are interested in them because they cause mild disease and they go. But we have 3 types which cause severe disease. SARS, if you remember, not more than 10 years ago, about 10 or so years, people are saying there's a virus, flu virus, or all those viruses in Asia, SARS virus. I'm sure if you're old enough to be listening to news and social media at that time, you know the SARS virus. We also had MERS, and these ones are causing severe illness. And now the third virus in that family, SARS-CoV-2, which is our COVID, okay, is also causing severe illness. So there's something called incubation period. Basically, the time you get exposed to the virus and it has access into your body, up to the time you start showing symptoms, you actually start showing that you're sick. So the average, it can vary from 2 days to 14 days. So some people take just 2 days after maybe someone coughed in your face. After 2 days, you also start showing symptoms. Some people, it's delayed up to about 14 days. But the average time, based on the way people are presenting and on science, shows that in 5 to 6 days from when you get exposed, you then start showing symptoms. Now, I'm going to focus on modes of transmission. Basically, corona making a nedi. How does corona get you? So there's something called respiratory droplets. I want each of you now to get your hand and just cough gently, just onto your hand. You can feel some small drops on your hand. But also, if you don't cough, you can remember some instances where someone was talking to you and they were very near, and you could feel drops, things are dropping on your face because someone is very far, and most times you will have stepped a step backwards, okay? So those are called droplets, very tiny, tiny pieces, tiny drops of saliva and respiratory fluid and things from our mouth and our lungs, etc. Okay, so COVID moves like by those droplets. If someone is near you and they talk and those things drop on you and they get access through your mouth, your nose, your eyes, you will get exposed, the infection goes into your body. And this is one of the reasons why masks are advised, because when you have a mask, it keeps those droplets to you. If another person is also wearing a mask, again, it covers their mouth and protects them. So this is one of the big reasons why we wear masks. And for some cases, if exposure is high, we also cover our eyes, especially for some of us who see COVID patients. Face must be covered completely. Your eyes must be covered, your mouth must be covered. The other is, of course, contact with contaminated objects and surfaces. If I cough and I'm holding my phone, I cough on it, I give you to talk on it, you'll hold it, those droplets, you touch your eyes, you touch your mouth, something, it goes on to you. So these surfaces get contaminated. That's why we encourage that they must always be cleaned, preferably, and if you're in a setting of high exposure, with some alcohol. People have always wondered, and that is the third issue, about if COVID moves in the air. COVID doesn't move in air, I'm going to tell you. Normally, if I'm walking Chalu in Pakwach town, COVID is not going to be moving in the air. If COVID was moving in the air, infections that move in the air are like things like measles. They move, they spread by even smaller droplets. They're called aerosols, like tinier. You get one droplet again and you break it into smaller ones. And wind can blow them. That is why if something like measles attacks, it can sweep a whole school and all the students are infected. Now, the droplets, that bigger thing which someone, it drops on you, you can feel, that one, it can be broken down smaller. And most times this is happening in the medical setting. So there are things we do when we are managing patients that make this thing be broken down into smaller particles which can be blown. For example, if there's a fan, there's air conditioning, they can be blown further. That is why in the hospital, when you're managing COVID patients and someone is doing some of these procedures, suctioning and all these other medical things, we have to be fully protected because the droplets are even made much, much smaller and the wind in there can push them, okay? But in the community, there is no air spread of COVID. I hope this is clear. This is just to show you the difference between droplets. You can see the man on the left, if he's talking, those drops are blue, those big ones can drop and infect either the surface or go onto someone's face who is near. That is, and for COVID, the commonest really is around 1 meter. By 2 meters, there are minimal drops. That is why social distancing is encouraged, such that the far away you're from someone who potentially is giving off droplets, you reduce the chances of these droplets getting on you, as opposed to airborne spread, which is the red one, just for comparison, to show you the difference, okay? And remember, again, COVID is droplet spread. So how does COVID present? So we said that from the time, let's say someone coughs on you, on your face, and you get infected, we said the average is 5 to 6 days, but it can take any time between 2 days and 14 days, which is 2 weeks. But how do you start knowing that you're sick? So funnily, some people never even show any single sign that they are sick. They get infected, the virus multiplies, they can even spread it, but even they themselves don't know that they are sick. And those are the most dangerous people, because no one knows they are sick. They also don't know they are sick. And so we interact with them normally. And so people get sick. It is like, I will compare it to HIV, when people used to say, you cannot get HIV from an AIDS patient. Someone who you see is sick. Those people like that don't spread disease. Disease is spread by people who look fine, people who look normal completely, but have the virus. The same applies to COVID. When people are asymptomatic, they spread it much faster because we reduce our index of suspicion. We are more relaxed with them. We sit with them in the community. We drink, we eat, we talk without masks, not knowing that this is actually one of the people who is categorized as asymptomatic. Now, if someone is not symptomatic, what is the other possibility? The other possibility is that they can have mild disease, okay? And mild disease, then there is moderate disease, then there's severe disease, then there's critical disease. I'll show you later what that is. But generally, the common signs and symptoms of COVID. And I'm going to tell you because I got COVID last year in May 2020. I even know where I got it from because we were in a meeting and yeah, it's I can identify where I got it from, but I had fever, incredible fever. My body would become so hot, especially in the evening. It was really, I would get very high temperatures, 38, 39. Luckily for me, I didn't have cough, but some people can get cough. Muscle ache, the body, someone has minced your body. Chalungati odu muscles perina order and left you, that type of muscle ache. It feels like that. Some people, of course, it's much milder. Also fatigue. You feel like if you're like 5 acres, you know, that fatigue of you can't even lift your own hand. You feel very tired, okay? Some people, again, not very much. It's a spectrum. Some people feel it, some people don't feel it. Then there's shortness of breath. Some people get short of breath, and actually that is a danger sign. If there is shortness of breath and you're COVID or you're a suspect of COVID, you must be in the hospital. There's even no discussion there. Some people get sore throat and headache, which are bara, all right? But again, other people have flu-like symptom, running nose, even flu, bebino, musuja, those things, that can also be COVID. Some people get diarrhea, vomiting, nausea, especially children. I know a child who ended up having an operation very recently, a child of my friend, 9 years old. And she had abdominal pain, diarrhea, and the doctor said, maybe this is what? This is something related to appendicitis, but it turned out COVID. So it can present also very, very unusually. But once there's exposure, once you have these other symptoms, we rule it out. And the one called loss of smell and taste is incredible. If you've had it, and I did have it, I could not believe you could bring the strongest smelling thing, alcohol, what, I could not smell any of it. It's quite incredible. And even taste, you cannot taste food. So once you have something like this, of course, there are other causes, but in the situation we are living in now, really, you must rule out COVID disease. So there are some people, so I've told you disease can be asymptomatic. Jumanyutu didn't go at all near Tuomakogi. People with mild disease, just a little bit of kumaremu, headache, body pain, and all. Then the people who become short of breath, the moderate, and we end up with people who need oxygen and people who die. So the people who are getting severe disease or complicated disease. Okay, now this slide, and I know there are going to be questions about the phase 1, the first wave, and the second wave. So traditionally, and this is from 2020, when the initial science and statistics started coming back, we were seeing people who are over 65, people with heart condition, jumatua sukari, diabetes, sickle cell, cancer, liver disease, people with HIV, people with lung disease, asthma, TB, kidney disease, pregnant women, malnutrition. So this was the traditional group we used to see, and this is what we're seeing in 2020. But I can tell you this year, in just this month, I have seen children, even up to 4 months old baby with COVID and very, very short of breath. So the disease has evolved. The virus we had in 2020 is not the one we are having now. We've got variants that have changed. The disease has evolved to us. It is to the environment and what it has been exposed to. Now there are different strains. So you're having the South African strain, the UK, the one in Brazil, and WHO has actually now given them different names, Alpha, Beta, Gamma, and Delta. And there are different names. I think the Delta is the Indian one, the Alpha, I think is the UK one. So there are different strains, and these strains are showing a different appearance. Now, they are attacking younger people. Long time, last year, we had very few young people in our COVID units, and most of them you would find are diabetic, or they have some lung disease, or some comorbidity, which would explain, or they have HIV. But now, we're seeing young people, people in their 20s, 30s, teenagers with COVID requiring oxygen, okay? You do a CT scan and it looks terrible. So the virus has changed. So it's not any pneumonia pajudongu, no, this thing is now attacking younger people also. So we must also be aware of that. Okay. Also, it is infecting very, very fast, and I'll show you the curve. in last year around August. So we said our first case was 21st March, and you can see that at the bottom, we had a few blips of disease. Sorry, ngatimuke tulingala no.
Other Alfred.
I'm going to mute everyone.
Yeah.
Sorry, and then
You're muting, ba? Mute.
Okay.
all right, I've muted everyone. I'll just go back to the presentation quickly. Great. So the fact that the second wave is characterized by variants, types, the virus has changed to become even more aggressive. You can see it from our graph. So from 21st March, when we got the first infections, you can see very small blips of numbers, just some roughness in the line, which shows that the numbers were very few. Now, as you move towards the right, you can see the numbers increasing. So in our highest numbers last year were around September, October, November, December. That is when we had the highest numbers of patients even admitted, okay? And then by Jan, Feb, numbers went down, and then March, April this year, numbers had gone really down. Now look at May. In just May, we're to do May, June, there is just halfway. In just 1 month, our numbers have spiked like over 3 times what they were at the peak of last year. So many more people are infected this time round, and we are still climbing up. This graph is still going up, all right? So let's look at Nebi. So this graph I've shown you is for Uganda, but let's look at what's happening in Nebi. So in Nebi, you can see last year again, March. You can see in March last year, the numbers were even 0, April. We started getting our first cases documented around May. 4 people, 5 people. The peak last year, we reached about 49 people. That is Nebi only. This doesn't include Zombo. This doesn't include Pakwach, as Dr. Sam explained. Now, look at the second wave, okay? In less than a month, we have reached 85 people. And you can see that this figure is Podube Medere Malo. We have not yet started coming down. So we are in the middle of a real storm, and people are actually dying. So look at these numbers. Analysis from Nebi district. So the whole of first wave, which is last year, okay, we had 132 cases, the whole wave. This in just beginning, or in just May, when the second wave started, and June, we've already reported 105, okay? Much higher, okay, than the number that we've seen. Of this total, it's 44%, much higher than we've seen the whole of, the trend, if you look at it statistically, is much higher. The deaths are already more than we had last year. The whole of last year's wave, in just 1 month, we have more deaths than we had last year. So the incidence is going higher, and the fatality, the number of people who are dying from this current wave and the types of virus that we have, is much higher. So the more reason for us to be more careful. Again, any graph just showing Nebi district, there's no Pakwach and there's no Zombo. So really, as people who are listening and in on this and our community, what is our role? So this pandemic is not for Ministry of Health or for government of Uganda or for doctors, nurses, clinical officers alone. No. This COVID can only be fought when each of us understands our role and each of us plays our part in fighting this pandemic. What ministries does and all we're seeing the tip of the iceberg. There's something called tip of the iceberg. Inano kidi, or iceberg, not ice, stone. Winano just we mube, I'll take it as a stone. Kakidi mokubed in the ground madit. We unano just small we matedi, but pain no puan kiditi. And this is what we are dealing with. cases in hospitals as doctors is just a small part. Bulk package unseen. It is in the community. That is why the role of the community is ever so important. So much, especially with COVID. Doctors, nurses, ministry, Museveni with His Excellency Museveni with his updates and all is managing a small part. The biggest role in fighting COVID is for each and every one of us. So what is our role? Keep your distance, at least 1 meter from everyone, whether they are sick or not sick, for as long as it is a person who can talk and is going to put droplets on you, okay? And remember, even if someone is sick, they may take up to 14 days before showing that they are sick. So someone will be sick near you and you can't see. Wash hands thoroughly. Ipachu in the compounds, please have hand washing stations, especially in the village. Let people wash their hands. Soap there, okay? They must come wash their hands properly so that hands are clean and free. If you have alcohol sanitizer, use sanitizer, okay? It should have at least 60% of alcohol. Tables, chair, mesa, comb must be cleaned properly, okay? Then let me water, please. I know now people are looking for stickers. I was on some group where people are saying, hey, when stickers come, me want stickers. Please stay at home, only move when it is necessary. Kamichidieno ichokuchigamutuo idokudipachu danu chakuto, and you really don't want to carry that guilt. If you don't have any big reason to move around Kachidi town, Kabedi group, Kanambo, please don't. Stay home. Let us stay home and allow this wave to pass when we are safe at home. The other role for us is vaccination. And this I know is a big discussion. To vaccinate or not to vaccinate. People struggled. We struggled with getting people to be vaccinated. The ministry did updates, education, people didn't, until people started dying, and then we woke up. But I'm really glad we woke up. So I'm going to just take us through quickly what vaccines are, how they work, so that you understand when you're taking a vaccine, what is happening to your body. So the vaccine basically is like a warning to the body and arms the body. It prepares the body to fight. So once you get the vaccine into your body, what it does basically, it goes in and tells the body, this is what the soldiers are going to look like when they come. The enemy, this is what the enemy is going to look like when they come. So what the vaccine is, it is like an image of the enemy, okay? And it goes into the body and shows the body, this is what the enemy looks like. So the body says, hey, okay, this is what the enemy is going to look like when they come. Yes, so let us prepare. And all the cells in the body are informed. When the enemy comes, they are going to look like this. Such that when the infection, the virus now, the real one now comes into the body, every cell in the body knows that this is the enemy. And so they immediately start fighting. Okay, it is like if there is a thief in the village, or let me say a thief in the village, or let me say a killer in the village. LC1 Gambino Kugine Kukuchalpa killer. Okay, Jaranek Newton Idanu Weng, yeah, Jaranek ne enen kamae, Chidi village ma Newtu, Chidi village ma Newtu, Chidi village ma Newtu. Nindu Majaranek enu nyonu area echa. Long dano zo ngeye, okay? So dano gam mobilizing, okay? Gig marking neutralizing and one achiel. And that is how the vaccine works. It goes into the body, tells the body what the virus is going to look like, and the body now prepares to fight. As soon as that specific bacteria or virus, whatever, and this is general for all vaccines, enters the body will know it and it will start fighting it immediately, okay? And that prevents severe illness. If a few of them gilui in the body, they infiltrate, they'll be too few. Most of them will have been killed, such that should the disease be there anyway, it will be mild. It will not be of the form that will kill. like that Jaraneg, if he had come in that area, Kaneg 100 people, then recognizing and okay, the people start hunting, and instead of killing 100 people, it may kill like 5 people, which is, yes, he has killed, but he has killed much fewer people, okay? Same to the body. The virus will come, but because you're vaccinated, instead of making you very sick and you end up in ICU, okay? It may make you sick enough that you maybe go to the hospital and they admit you in the general ward, or you even stay home, you get sick, but you're not too sick to be admitted in the hospital. And that is what happens with the vaccine. I'm going to talk about the WHO process because I know there are people who have read a lot, as we should, and are going to ask about what about this emergency use listing? What does it mean? Why have some vaccines been approved? Others have not been approved. So WHO has a committee called the SAGE, that is a committee of advisors that advises on anything it's a strategic advisory group of experts, okay? The SAGE, strategic advisory group of experts that advises the WHO on some of these things. Now, as far as COVID, so they give advice, especially the vaccines have been a big one for the SAGE. So what the WHO does, there's something Magilwamonya emergency use listing. So emergency use listing is not only for vaccines. If there is an emergency, a condition that has become an emergency as far as WHO is concerned, there are some products which can help to manage that public health emergency. It can be a medicine, it can be a vaccine, it can be even a diagnostic tool, maybe a test or anything. What they do is they assess it, okay? Look at the benefits of that drug, either the treatment or a vaccine versus the risk, okay? They also then assess and say, okay, the benefit of us using this is higher than the risk. They also then give you an approval, okay, to readily make it available, but they adhere to very specific rules on safety, efficacy, and quality before these things are approved. Therefore, I can confidently say that the COVID vaccines have gone through this process. And there's not only AstraZeneca, there are others. There's Pfizer, there's Janssen, there's Moderna, there's the Chinese one, the Sinopharm, or CoronaVac. They've been approved, okay? And WHO continuously reviews new vaccines coming in, and they all go through this process. AstraZeneca is the one in Uganda. There are different people making AstraZeneca. There's the UK, Oxford, it's actually started in Oxford. There's the biotech in India, in South Korea, and then the Serum Institute of India. Those are the main producers of AstraZeneca. Now, why am I talking about AstraZeneca? Because it is the vaccine of choice that Uganda is currently using, government of Uganda. You all remember that in 10th of March, this year, we got 864,000 doses for free from COVAX, which is a group of facilities under WHO. It's a COVAX facility, a group of institutions and countries, basically working to make vaccines accessible by even the most poor country in the world. I kid you not, if we didn't have COVAX, these people have been hoarding, vaccines are being hoarded by the rich countries. They're paying and buying bulk. It's like a market. You saw Israel, what the Israelis did. The Israelis bought a lot of vaccines, I think at 3 or 4 times the price of the normal vaccine. And when Benjamin Netanyahu was asked, he said, well, the price of having the vaccine is much cheaper than eventually the price of people dying of COVID, severe and critical COVID in Israel. So having a vaccine really is very important. And AstraZeneca is in 2 doses. Each of them is half a mil, very small volume of virus. It goes in and it does what I told you the vaccines do. Now, there are questions about whether AstraZeneca is made from live coronavirus. No, it's not. So I told you there's a clan of viruses where this COVID belongs, okay? So what the guys did in Oxford, they got an adenovirus, which is a bigger name for these COVID coronaviruses. They got a specific one that affects chimpanzees, okay? But actually doesn't affect humans. It affects chimpanzees. And then they extract something from it called the spike protein, okay? and then they put it in a cell to make the vaccine. Now that spike protein, because it is from that same family, when it's injected into the person, okay, into a human being, then the body, it shows the face really of COVID, and the body now starts recognizing, prepares to recognize COVID when it comes in, simply because they're from the same family. All right. The good thing with AstraZeneca, it can be stored at degrees which we can manage, 2 to 8 degrees, which is really manageable for us, and up to 6 months. And in countries like Uganda, you need that. There's some vaccines which are stored at -40, -80 degrees. We can't manage that in the country. Okay. So AstraZeneca works very well. I'm going to take you quickly through performance of AstraZeneca. So we talked about variants. Does it work against variants? Yes, it does. Okay, the alpha variant, studies have shown 86%, even in 90s for some variants, it does work. But more importantly also, the faster we roll out the vaccine, the faster we stop the production of variants. Okay, variants are like the vaccine creating, it's different, showing us different faces, changing faces. It goes in this area, the environment is like this, it changes itself to a different, more virulent state, like that. So that's how variants develop. So making variants is a normal process, and many diseases actually give variants. Many diseases, they go into a place, they change depending on the environment. The problem becomes when the variant itself becomes a type of variant which is more aggressive or more, for a certain reason, more concerning. And that's why you have terms coming up telling you a variant of concern, okay? So is AstraZeneca effective against variants? Yes. Does it prevent infection and transmission? So we know that as far as infection, if we have most of us vaccinated, we're going to create what is called herd immunity. There's a very good WhatsApp message that has been circulated from the chair of the Scientific Advisory Committee, Dr. Misaki. You should read that. It's very good on explaining some of these things. But there's 2 options. There's the individual protection. Me, I take the vaccine. What it protects me against is severe and critical disease. Okay, I may still get mild disease. I may still transmit it. But on a population aspect of it, if many of us are vaccinated, if we can achieve, for example, the target of like 60% of our population vaccinated, we shall then create what is herd immunity, HERD, okay? Which means we all, because we are most of us vaccinated, the infection rate is very low, and also people severe and critical cases are reduced. And that is what we are hoping to achieve with vaccination. So if the vaccine comes, please get the vaccine. Of course, the priority is health workers, initially teachers, security personnel, people over 50, and these are people who are at risk of getting severe and critical disease. That is why the initial ministry strategy was, please let us, we hope to vaccinate a good percentage of the population. But because the initial volumes were few, these were the people targeted. As there were challenges, I know many people on this call, and some people may say, oh, I'm 30, but I got vaccinated. Some people did get vaccinated. And a lot of that was to fast track utilization and also to build herd immunity. But generally, as a guidance, the people who are at risk, people who should be vaccinated first. So yes, can people who have got COVID before, and this is a contentious one, can people who have got COVID in the past be vaccinated? Yes, they can. Initially, and you know that COVID is an evolving disease. Initially, there were guidance of around 6 months. Then there were changes. People started talking about 3 weeks. So the current WHO recommendation, and this I got from the WHO lead for new vaccine at WHO African region. So once someone is negative and they're okay, they don't have symptoms at all, then they can get, and this is for people who have had COVID. I've been sick. This week I didn't, next week I test, I'm negative, I don't have any symptoms at all, I can get the vaccine. Does this mean that people should now be testing for COVID? No. If you're not sick, just get the vaccine, please. If you're not feeling sick, get the vaccine. If you're feeling sick, get a COVID test. Okay? If your test turns out negative, get the vaccine. If your test turns out positive and you are sick, like we said, then wait for the sickness to heal. You have no more symptoms, you're COVID negative, then get the vaccine. All right. Can breastfeeding women be given? Please, breastfeeding women can get it. I can confidently say I've got it and I'm breastfeeding my daughter. I got the vaccine and I've got both doses. Nothing has happened. I didn't stop breastfeeding. The day I got the vaccine, I came back home, I continued breastfeeding. Okay, there's nothing wrong with me. There's nothing wrong with my daughter. So you can continue breastfeeding. Pregnant women, of course, pregnancy is a risk factor for severe and critical disease. If you're pregnant and you're a health worker, and I know friends of mine who are health workers who are donning, wearing PPE to go and see COVID patients, they got the vaccine because they're at high risk. If you have a minimal risk, you're staying in Puero, you're alone, you don't have exposure, you can say, okay, we can wait for the pregnancy to come out, and then for the lady to deliver, and then we can have the vaccine after. That is reasonable. But if you're at high risk, okay, you're staying in an area where the population is high, there are many people in and out, you're exposed to many people, you don't know where they've been, you're at high risk, you're pregnant, get the vaccine. All right. About infertility, there is no evidence whatsoever that any vaccine currently licensed in the world, including COVID, causes infertility. So, but there are people who should not get the vaccine, and who are these? So if you have any history of an allergic reaction to any component of the vaccine, or even any vaccine previously, like you got a vaccine, say for yellow fever, and you got a bad allergic reaction, you even had to be admitted, you got adrenaline, your body was swelling up, please don't take the COVID vaccine. All right. The other group, of course, is children 18 years and below. And the reason for this is that there is still ongoing research about it. Initially, there were some discussions around people who are over 65, and I'm saying this for the benefit of people who read. And people are saying if you're older than 65, in I think some countries in Europe, they were not vaccinating older people. No, a study was done in the US, and they showed that even older people, no matter how old, even 80s, they recruited people, because the initial vaccine research didn't include older people as participants. And so after these issues started coming up, the researchers did another study in the US, and they recruited older people, 80s, 70s, and they found that it is the same. It protects them, and there was no issues with them. So all age groups except less than 65, and this is really what I've been talking about. The precaution, of course, if you get the vaccine, some of us may go and we don't know that we have allergies to these components. And so the Ministry of Health recommendation is that after you get the vaccine, you're observed in that vaccine site for at least 30 minutes, because allergic reactions happen very fast. If the allergy happens, if you're allergic, it will be even 2-5 minutes, it happens. So we give a span of up to 30 minutes, so that if you have a reaction, it happens and it's managed immediately. So observation, 30 minutes, then you can go home if nothing happens. So that's the vaccine, a summary of the vaccine. And for me, the summary is, if you don't have a severe allergic reaction, really, if you're in the group that shouldn't get the vaccine, if you're not in that group, all of us, when the vaccine comes, please get this vaccine. So let's talk about what if you're infected. So we've said there's generally 5 things that can happen to you. You're asymptomatic, you don't even know that you have the virus, and you carry on, you spread it, other people get symptoms, and for you, you just get shed of virus, and eventually you're fine. The other option, you can get mild disease, like I told you I had mild muscle pain, I had fever, and chills, and that was really it for me. I didn't cough, I didn't have any shortness of breath. That was me. I got mild disease. But the people who got moderate disease, you get it, and you're a bit sicker than most people. You can't even walk, you're bedridden, but your oxygen is fine. It's really above 92. For pregnant women, it's above 94. But there are then those who go into severe disease, okay, and critical disease. These are people who will require oxygen. Now, the challenge we have is that there are some people who are staying home who should not be at home. but there are also some people who really should be at home when they have COVID. So there are two things. There's home-based isolation and home-based care. It's really the same thing. If a person is confirmed to have COVID, okay, there are some people who we can tell, comfort them comfortably, please stay at home. But in telling you this, we have to link you to a healthcare worker who will monitor you. And while you're at home, you will be receiving care. Your caregiver may be your family member, it may be a friend, it may be someone in the community, it may be a VHT, but they come and check on you and make sure everything is well with you. So why did the government start encouraging home-based care? Initially, the virus was when it came, like from last year, March, it was in a few places. Here, we found 5 cases in Gulu, then what? It went until we went through all 4 phases and we reached a state where the disease is in the community and they're still there. The disease is everywhere. Okay, that's why you really have to be careful. Okay, the burden, if we are to get all the positive people in Uganda, if someone, for example, had a magic gun and they can, a magic stick, and they could just point out and show us all the positive people in Uganda now as I'm talking. And we say, let us put them in all the facilities in Uganda. We will not manage them. We won't have enough facilities. We won't have enough health workers to care for these people. That is why we said, okay, let the mild people stay at home. While they are home, let us then have guidance for how they should be managed at home. But there are some people who, because of their various conditions, cannot stay home. But while these people who are sick are at home, you know that you have a sick person, you all know this person is sick, you must still prevent the spread of the virus to the family, the wider community, okay? Especially those who are vulnerable, okay? So while staying at home will greatly reduce the overall amount of infection but it can still be passed on to other people in the community. So it has to be done very well, right? Now, the decision to make someone stay at home, home-based care, okay, is based on clinical evaluation of the patient. Are you a mild case, for example? Evaluation of the home. Is the home able to maintain you there without a risk of you spreading the virus, without a high risk? If you have a one room, like Pachumami at home, what it's, the hut is just one, but you may have a few other huts in Idielela. So you can say, okay, there are 12 bed kare in this particular hut, then someone can help and check. But you may not have that luxury near. There are many huts in the compound. You may have one. So if you have one, then maybe it's something you may need to say, okay, let this person at least HED Health Center, okay? But also, we don't want people mabedu at alone. Kabedunia ngati bedu kende, and this person, we are going to do a home-based care. No, someone can actually deteriorate and die in the house. So home-based care is a very delicate thing. Unfortunately, now there's a lot of home-based care going on. Okay, so who can we consider for home-based care? It can be a child or an adult, either confirmed or suspect, but they have either no symptoms, so they're my asymptomatic friends, or they have mild symptoms. Also, they should not be people at risk of developing severe disease, okay? Then I will show you people who are at risk, and we went through those people. It may not be an elderly person, Muzee of 80 years old, you're putting him at home. You know that in about 1 week, this one might be a patient who needs oxygen immediately, all right? Maybe someone who has cancer on chemotherapy. These are not people you want to keep at home because you know the risk of them getting very sick is very high, okay? People who are pregnant women, 3rd trimester, she's got COVID. These are people you might say, let us first monitor this one in the hospital a bit. So there are a few categories of people that you want to rather have in the facility. But if someone meets a criteria for home-based care, there are times you cannot predict. And like I've told you, this virus keeps changing. There are some people you think will be fine. Like previously, a 30-year-old should be fine, okay? But sometimes they go home and they actually get very sick. So how do you know that someone is getting very sick, and you must rush them to a hospital or you must call an ambulance? if they have difficulty in breathing. Now, me, I don't care if you what age you are or what, as long as you have difficulty in breathing, you have no business being at home. You need to be in a a hospital, health facility. If someone has very high fevers every day for more than 3 days, that is a danger sign. Take them to hospital. They might be going through there's a stormy period in the COVID pathway. Okay. People who are disoriented, someone be wechu, lemebe wechu denyangerengo, but etioku COVID. Please, people like that, they must be in the hospital. People who are too weak, inanungati gine pegu pei kume at all. Okay, these are very, very sick people. Okay, people who are very tired. Pegu, there's no strength at all. Hospital. People who can't eat or drink, please, hospital, because in 2 days, the things that are killing them will even now be related to food, and you don't want that. In hospitals, we know how to manage people who cannot eat or drink. We know how to feed them, okay? People who have a jaka and all this, when they have COVID, straight to the hospital, okay? These people, please don't keep such people at home, people who have cancer, and we've gone through this, but just to re-emphasize, okay? Very young children, less than 1 year, people older than 60, people with heart disease, diabetes, cancer, these people should be monitored in a facility. All right, but also the health worker, and I know some people are going to clinics, even in Kampala, Kadi Pachu, Giwanya COVID Corona Tie, ento inwamiti doki Pachu, you can go home. But Ngatimube Chweli Pachu, the person sending you home, sorry, I keep switching, but the person sending you home should give you some basic information, personal hygiene, okay? Maintaining your mask on your face, washing hands, diet and nutrition. Psychosocial is a very important thing, and it even came up on our chat on the Greater Nebi Health link. People need a lot of psychosocial coping skills, okay? Then things I've told you about, these signs and symptoms. Whoever is caring for the person needs to know, nia giwachu odiat nia, kangati pegu paredok, pinya kecha, nyo ajaka jaka, nyo ebe chamungo, nyo echa kuyui marachi, those things, meted doki odiat. Those are very important things that you need to know before you go home, okay? But there must also be a linkage. And I know sometimes people struggle. Ubedu kujara tuo, mutkari pay village when you kwayu kunu elipira beach to take the jaratuo. These are cases where you need to have the number of the DHO, or health facility, health center 3 or 4 minyetu. There should be some connection to someone who can help you to evacuate this case to the hospital. Now, there are therapeutic options, and I'm going to pause on this slide because Pimu on social media is a bit too much, please. Dano be circulating types of antibiotics, me and manenu jumi corona de podakia ungoi prescription. Inenu yatma take chalo ivermectin, ango yatman. If you don't take these medications with monitoring, people are going to come to us. Corona is going to end, but 2 months down the road, we are going to have diabetics. We are going to have people with kidney disease, all from YAT, not from COVID at all. Not at all from COVID, but from KIT-YAT, the types of medicine that people are writing for their friends. Someone says, your father was sick, they wrote for you these medications. So you take that picture, you circulate it. Now all your friends who are not your father, who don't have the chronic conditions, who are not assessed medically, who do not even know the level of COVID they have, are going to swallow that package. That package often, and I'm going to read them, people are giving dexamethasone, prednisolone. Do you people know what those drugs do? For me, myself now, if you tell me to swallow dexamethasone, no way, I cannot. I know what that drug does. Those are steroids. There's a lady we saw last year, she had taken dexamethasone for 6 months. She came when the conditions she had multiple organs were completely failed. The pancreas was not functioning because steroids suppress a lot of normal body functions, and the effects that you have are terrible. When we give steroids as health workers, we give them for specific people. And I'm not going to give you the details because you people are going to now say, hey, Dr. Lenyo said now patients on this can give steroids. Please, those steroids are things which should be prescribed by someone who has a medical license. If you don't have a license, stop circulating those things. When you see that message, just say, Jesus Christ, this one stops with me. I'm not going to forward it. What we recommend for home-based care, I've told you that people must be mild or asymptomatic. Give them vitamin C. And even if they don't swallow vitamin C, we are lucky we're in a country like Uganda, where you walk out of your house and look on the road and you see vitamin C. Fruits are everywhere. Pineapples are everywhere. One pineapple is now 500, 1,000. Please, fruits and vegetables. Those things are going to give you these nutritional things you need, okay? Zinc sulfate, yes, you can take it. 2 milligrams once daily for 10 days. Panadol is what we give, and not Panadol is also a drug. All drugs have side effects. That is something people must remember. You might think you're just circulating drugs, but someone will have mild COVID and they come to the hospital 2 weeks later, not because of COVID, but because of the drugs they have been swallowing. Panadol is a very dangerous drug if given, and if given excessively. You all know that. Any drug really, if given wrongly, is dangerous. So Panadol, 2 tablets or 1 gram. Some people are making the stronger strength, 1 tablet 3 times a day. If someone has fever or if they have headache, that's it. I can tell you that when I had COVID, this is the only thing I took. I only took Panadol and zinc. Vitamin C, I woke up, I drank orange juice, I ate pineapples, I ate lots of fruits, and I got my vitamin C from nutrition. Other things you can do, honey, ginger, garlic, citrus fruits, yes. These are not treatments for COVID. And I'm going to repeat, these are not treatments for COVID. These are things to make you healthy as a human being. Even if it was not COVID, even if it was, let me say, cholera, which had attacked, I would still be on this chart telling you the same thing. Guys, for your body to boost its immunity, to fight any other disease, not just COVID, anything, okay? Itakaya, what, anything. Eat fruits and vegetables. Really, is this the first time that you've heard that you eat fruits and vegetables are healthy for you? I'll talk to fathers. Today is Father's Day. Fathers, haven't you always encouraged your children to eat fruits and vegetables? It's the same thing. But with COVID, people are making it seem like if I drink a lemon, I am treating COVID. No, it is not treatment for COVID. You're just making your body healthier. As per norm, as before, eat fruits and vegetables. And please, no antibiotics. You can see on this slide, there is no amoxicillin, there is no azithromycin, there is no ivermectin, there's no steroids, there's no dexamethasone, there's nothing. The reason is because these are drugs that have to be given for specific indications. If we all, 40 million Ugandans, if let's say 20 million of us who are on social media watching these things, start swallowing azithromycin, we shall swallow it, nothing will happen to us. I tell you, in December, if we get pneumonia, when it's starting to get cold and people actually come with pneumonia, we won't have things to treat you with, because the body in Uganda now, our bodies will be used to these antibiotics. And so we won't have what to use to treat you, because you've made these drugs a joke to your body. Your system now recognizes them. Oh, azithromycin long time, anything. Augmentin, amoxicillin. The body will just, this is your body talking to those drugs as you're swallowing them. Azithromycin, augmentin, amoxicillin, anything. And that is your body with a bad infection, which could have been treated by these antibiotics if we had not abused them. So let us not abuse these antibiotics. Remember also, by the way, that COVID is a virus. Antibiotics treat bacteria. So there's a lot of things. People have become WhatsApp doctors and got first Google medical degrees. Please, let us avoid these things. They are going to harm us in future. This is also for children, and it's really the same. Panadol, just go to the pharmacy, they'll measure your child or based on your age, and your parents, you know this. If you don't, you know that children's drugs are always based on their weight and age. Really, usually the weight, but the age and weight are usually extrapolatable. So we usually go by that. But based on your child's age and weight, we recommend treatment. And it's really the same. Fruits and vegetables to boost your body's immunity, not just for COVID, but for any other thing. And then Panadol to manage body aches and fever. This slide I have put just to help you with referral. So you must always have an evacuation plan. If you're having someone at home, the possibility that they can become sicker is there and it's real. So the caretaker needs to know those danger signs I mentioned, so that as soon as you see them, you immediately alert the system and you have your patient in a health facility where more advanced care can be got. This is something I've picked from multiple charts that are going on. It's called a pulse oximeter. Previously, it was privileged knowledge for health workers. Now it is common knowledge. If you don't know this, it is something that measures your oxygen level. If you have someone at home and you can afford this, please have it. The problem with COVID is sometimes someone may not even show you that they are short of breath. But when the oxygen levels have gone low, the oxygen levels have gone low, but they are not struggling to breathe. In medicine, we have even a term for it. We call it happy hypoxics, okay? The oxygen is low, but they're still looking nice and happy, okay? This can help you. If you can't afford it, please focus on the symptoms, the danger signs that I showed you earlier. Another thing, of course, recommendations for feeding. Look at that beautiful colored diagrams. Fruits and vegetables, they give energy. I've told you with COVID, you have very low energy. If you give someone energy giving fruits, bananas, sweet potatoes, maize, they're energy giving foods. Protective foods, your leafy vegetables, your pumpkin, carrots, ntula, bilinganya, cabbages. Protective foods, bananas, bodybuilding foods, your legumes, beans, malakwang and all the, fish. Your bodybuilding are really your proteins, your beans, angira, angara. Yes, there we go. Fish, chicken, those things build the body. So these are standard things. And even when COVID ends, friends, continue eating these things, okay? Feeding should start immediately following admission. Make sure there is balanced diet. At least someone should eat 3 meals, breakfast, lunch, supper, increase fruits and vegetables. For your COVID patients, at least they should drink 8 glasses of water. All these things help them, strengthen them as a person, okay? It doesn't treat the virus, but it helps the body itself to fight the virus and its effect and helps them recover faster. We've said they have low energy. If you give energy building food, they will feel better. They can be dehydrated, they're not eating, give them water. It makes them feel better, okay? So manage the person. You would manage. And this is one of my favorite slides in this presentation, okay? Steaming. Uchi wang, yugam keliu odiat with burns, not from COVID, but from burns. And I can tell you that a burning in the face is very dangerous. If your throat starts swelling up, these are very dangerous things. I've once treated a girl who was epileptic. She was steaming herself in the bucket, egame jakere, epodu, head first, a bucket. We had to keep her in ICU on a ventilator just because mute all was swelling up, she couldn't even breathe. But leave alone burns. Steaming again does not treat COVID. People are putting themselves in hot things, even electricity connection, nyangerengo, and they're coming out hot and sweaty and they're feeling, I've treated COVID. Please do some exercise. Go and jog or ride a bicycle or take a walk and get that feeling of exercise, okay? Steaming is not treating COVID. It does not treat COVID. There's no science around it treating COVID. Previous steaming has been done in the salon for facials and it's very mild and all. Yes, that is steaming, we know. But this steaming near in some small room, you're going to suffocate yourself, and people are even putting their patients who are hypoxic. Oxygen utia 88, nobody knows. You can fungo someone in a small room, oxygen died, kinemu yabu when the person has collapsed. And this has happened. Last week, we took a body from one of the suburbs in Kampala. Someone died just after steaming. So please, let us be very careful. And then in the middle there, we can see all types of leaves. People are going to make you even eat leaves from plants which you have in your home, and you're going to buy them expensively. Please, guys, these leaves could be chamswa. There are some leaves we know, some herbs we've been using. Rosemary, yes, mint, those are common herbs we know to help enhance the smell of food, but also give us health, like our fruits and vegetables. What I'm now hearing, people are swallowing marijuana. You are not treating COVID. You're going to take marijuana, you're going to get a drug addiction, you're going to get complications from substance abuse. And those complications are so many that this will be another webinar. Maybe Dr. Kennedy can organize another one for substance abuse and complications of taking njai and all these things people are swallowing. Yes, you may feel euphoric in the beginning, but the effects of these are very dangerous. Please don't take njai. I've shown you the slide on what to do. Finally, a reminder, wrong is wrong, even if everyone is doing it. It is wrong, it is wrong. Right is right, even if no one is doing it, and it is right, it is right. So let us please start doing what is right and avoid what is wrong. This is discharge from home-based care. When should you stop home-based care? If someone has no symptoms anymore, the standard days we discharge patients is after 10 days, all right? 10 days, even in hospitals, if they're not on oxygen, no symptoms, 10 days, we send you home. We don't even do the repeat test anymore, okay? So if they're asymptomatic, if they've completed 10 days from when they had their initial positive tests, then they are fine. They can be assimilated in the community. You can take them you can take a walk with them freely. You can integrate them back automatically, or, you know, part of community, just 10 days. In the case of death, please call the DHO or the nearest health facility to assist, because we do know that some people are just suddenly dying and nobody knows. Recently in Busoga, there's a village, just last week, village Moku, I don't know if they have not been listening to news, please. Gichakuwanya, people are dying, they become short of breath, Tebasa bulungi, then Bafa. Really? COVID is everywhere. Let us be attuned to what's happening in the community. COVID has been spread, it has gone to the grassroots, the deepest grassroots. This is not a disease for Kampala anymore. It is in the deepest, in Pukwero, in Nyaravur, in War, everywhere it is there. Even Kinganya Trading Center, Matidi Muno, Kamubema die Gineno, COVID upe utie, it is there, okay? So when someone just suddenly dies short of breath, take all the DHO, let these bodies be tested for COVID, okay? So that we can know. And then the body can be handed back to the family. This is just the roles of stakeholders. The DHO really kit here in the village, sorry, Ipachu, Pakwach, Zombo, and Nebi. Please, the health center, have your nearest number for the nearest Daktari me health center move. Okay, I keep going back to Pukweru because that is home for me. Ka bedi Pukweru, mita bed ku na at least number pa gini pajumi Pukweru Health Center 3 no. Ketu kadle mungu timaire pachu, ngati chopu even ka running very fast danu bino nani wajara tuo. LCs should know, LCs mitu gingei i village i community megi kama tuo tie kae ngati kumelit mitu gibeka monitoring VHT gibeka tiu lembe pa government kujumi Kampala ngo kendgi lembe is deep paka i village. So Jumi community must understand their role, okay? And the patients, people should be transparent. Lemi kanutuo, ibi kanutuo igamto kutuo peri for nothing. Kudikan tuo kibe winjere ngoma ber watch ni dano ketu giteri odiat gitesting in kakumilit giketi odiat ka tuone chopu gine ka gichopu treating ini pachu de gitweri pachu but no ngati be monitoring in. So all of us have a role in managing COVID. Don't hide your sickness. Don't say, now I can't smell anything. If I tell people, they are going to think I have COVID. Please be open. This disease is for all of us. Be open, be tested, be treated, and go home well. I've put a few numbers for the DHOs. If you're in Kampala, and I do appreciate some people are listening in from Kampala, please call the Metro EMS hotline, 0800 990000. If you have any questions for advice, if you need an ambulance, call that number. If you're in Zombo, that's the numbers for the DHO. For Zombo, Dr. Mark Pakwach, Dr. Paula Jal, and maybe Dr. Justin. I know that this presentation has been very long, and I have officially, 30 minutes. Almost an hour. Anyways, so I'm done with the presentation. I'll hand over back to our moderator, Dr. Kennedy. And I know there are many questions. I see the chat already has 30 questions. We will try to answer them. Dr. Sam, myself, and also the other doctors from the Greater Neby Health link that are on the line can help us with answering some questions so that we divide and conquer. Thank you very much. All right, I'll hand over the host back to Dr. Kennedy. And
Right. Thank you so much for that. Dr. Annette, you had locked me out. I was talking and talking to
sorry,
myself.
I realized.
Yeah.
Sorry.
But I couldn't stop you, because the information you were giving was so rich. I didn't even want to stop you and just try to remind you about the time. We still have about 30 minutes. But Dr. Annette, that was really, really, really very, very rich information you've given us. And typical of the Aleños, we from Greater Neby are so accustomed to the name Aleño when it comes to delivering. And you've done that. So the legacy goes on. We are very grateful for that. I'm seeing a lot of hands up in the air. I don't know if Dr. Sam still has something to add before we open up the forum to everybody for discussion. Dr. Sam, are you there with us? Right. If he's still occupied or something, Dr. Aleño Annette, there has been a lot of queries about the vaccine, especially. I've been looking through the charts. You answered most of the questions, actually. But some of the things that have popped up, I'm going to read them for you. How effective is it to vaccinate with more than one vaccine? I see Dr. Sam raising his hand up. Dr. Sam? Go on, sir.
Yeah, you had. I was muted, so I could not speak until I had to do it the local way.
Yeah, sorry.
Thank you. No, I just want to add just a few things. Only, first of all, I want to thank Aleño so much for delivering. I think he delivered in the style of teaching medical students, coming down to the students, and so that they can pick and really understand. I want to thank her for that. She's quite a good teacher. First, I want to say that I have seen on the chat somebody's asking about the recording. I think from our side, we have done this for the sake of our motherland and for Neby, for Greater Neby, and for Uganda, and for anybody else. So as I wrote one time in one of my WhatsApp recently, that selfishness of knowledge is only a gift for people who have studied but have not got education. For us, we're educated, so we cannot be selfish with the knowledge. We will be happy if you can give it to be replayed on our local radio stations in Pakwach, Neby, Zombo. We have no problem with that. Number two, people have in the past asked why we are spending a lot of money on COVID when we have all other diseases. The thing is that COVID, all these other diseases, malaria, plague, whatever we are having, they're there, but they don't spread as fast as COVID spreads. COVID spreads so fast, and you must try to control it. And treating one case of moderate, severe, or critical COVID case is extremely expensive. That one case, whom you don't want to die, will cost much, much more than it takes to treat any of these other diseases. That's why we spend a lot of money. Three, Dr. Aleño talked about the pulse oximeter as a tool that probably all of us must have in the house. Don't think this is a complicated machine. It's very easy to use, and it costs now only between 60 to 80,000. If you wait in this second wave, very soon it will go back to around 300,000 shillings. So please get it. Currently, it is between 60 to 80,000 in Kampala. Here, you can easily get it. Somebody has written on the chat that what about when you have ulcers and you're taking the ginger, the citric acid, and so on? First of all, the thing is that in my own experience, I've realized that many people who say they have peptic ulcers actually don't have peptic ulcers. They have only mild, irritation of the stomach due to something they have eaten or something. They really don't have peptic ulcers. But even when you have temporary dyspepsia, irritation of the stomach, that can easily be managed by other medicines. But you need to keep yourself healthy by taking these things. What is the relationship between COVID and underlying diseases? The relationship is basically in terms of how the disease affects the body. COVID works mainly through the production of defense mechanisms, which are called cytokines. And especially when you're going into moderate, severe, and the critical COVID, it means there's a huge storm of that. And as Dr. Lenyo explained at the beginning, they begin to attack the virus, but also they identify certain elements within the inner side of your blood vessels, the heart, and so on, which seem to be like the body on the virus which they're attacking, the spike proteins. So they begin to attack the inner side of your blood vessels as well. So in the end, if you have diabetes, your diabetes, first of all, is already lowering your immunity. Diabetes lowers your immunity, and so makes the virus itself takes the upper hand. But your diabetes also affects your blood vessels, especially those blood vessels to the kidney, and other parts of those and smaller blood vessels will already have been affected by your diabetes. In a similar way, your blood pressure will have weakened your heart, but also will have affected your blood vessels. And this virus is coming to damage it more. In other words, the underlying conditions already have weakened you. So they make your body defense to the disease already subdued. And so the virus or the reaction of the effect of the cytokines attacking you will affect you much more. Studies are still going on to see whether, other than working through production of this defense mechanism, the virus has a direct effect on the tissues, on your tissues, your pancreas, your brain, your kidneys as well. And that seems also to be likely. So there's a combined effect on your body. There is also something on the chart about, related to vaccinating somebody who is asymptomatic. I would like us to go asymptomatic or has the disease. I would like us to go back to the presentation that Dr. Lenyo has made. What the vaccine is and how the vaccines work. When you have the vaccine made out of the protein, made to attack the protein or made from the protein on the spikes of the virus, that vaccine itself is not the virus which is going to cause the disease. Even when you have the vaccine made out of the subdued virus, the virus made inactive, what we call in medical terms attenuated, that virus is not going to cause any disease to you. So whether you are now having active virus in you, you are asymptomatic. This other one, this vaccine, made out of attenuated virus or inactive virus, or made out of the protein, or made out of the DNA or an RNA from the virus, put into a virus which is not dangerous to human being, this will not cause any disease. So it will add nothing to the process of the other virus which is already in you. The only reason why it may be good to delay vaccination when you now have the disease, you're not even asymptomatic, you are now having active disease which is symptomatic, is that you might have like anybody can react to any vaccine. You might have a reaction, a mild reaction, moderate reaction, fever, and so on, due to this vaccine. But at the same time, you are also having some fever due to the disease itself. Now, that can be what we call mimicking. You don't know which one is actually causing you now the fever itself. You might be busy managing only the fever due to the reaction or to the other one. So, but if you are asymptomatic in the first place, it means there is already no disease. It is not, the disease is not causing you any fever. It is easy to know that the fever I'm developing is due to this reaction. Number two, people think that when I have the disease and I get vaccinated, the vaccine may stop the process of the disease. If you already have the virus which is causing you the disease, the vaccine will not alter. The vaccine itself will not alter the effect of the virus which is in you. If the virus is going to remain asymptomatic, it will remain asymptomatic. If it is going to cause you disease, it will cause you disease, even when you have taken the vaccine. And then thirdly, related to that, the only reason why, other reason why it is good you can relax and postpone your vaccination. I'm not saying that you should postpone after you have got COVID. After you have got COVID, you have recovered, as Dr. Lanyu said, the moment you are negative, actually you are ready to go and get your vaccine. But the only reason why you can relax a little bit is that the current studies tend to show that the antibodies generated due to during the time of the infection last a few months at least, maybe about 6 months they last. And also when you're vaccinated, it will take time to build up the antibodies, as she explained. And when you get the second dose, it will go higher. And you may still stay maybe up to about 8 months or so already with antibodies. So you have already built some antibody due to the disease that you have just recovered from. And you may be protected by that to some extent for some months. But remember, just like somebody who has just been vaccinated, you are still vulnerable to getting another infection for the reason that she has already explained. So another thing which has not been asked here, but I've heard quite a lot, even as we were getting onto this forum, it is one thing which made me delayed connecting by a few minutes. People say, I have the choice to be vaccinated or not. Yes, you have the choice to be vaccinated or not. But remember, you don't have the choice, you don't have the right, you don't have the privilege to infect other people. So if you are not vaccinated, and there is no herd immunity, especially in the community, and you are asymptomatic because you stubbornly refuse to get vaccinated because you're exercising your right, know that you don't have the right to go to the workplace, to go to the market, to go to the public and infect other people. And that is where regulations are going to take place, public health regulations are going to take place. And you might be thrown out of your job. You have the choice not to be vaccinated, go and relax at home. And that is why today some countries are refusing entry. You have the right, you have left your country, you are coming to their country, they will say, okay, go back with your right to your home. You don't have the right to come and infect our people here. So I think I will stop there. Maybe finally the word herd, she was talking about herd immunity, herd immunity. What is this? It is not the herd, which is H-A-R-D. It is the herd, depends on how we pronounce it, the herd, which is H-E-R-D, which is like a herd of cattle, a herd of goats, group put together. That's what we mean, the herd, the community. So I think I will stop there, moderator, and allow others. Maybe I've already answered some questions which were on the chat already, and then we can take others. Thank you.
Thank you very much, Dr. Sam. If there's any other person who has anything to add to that in our team of experts, please go ahead. Munguriek, you've been raising your hand for a very long time. Please unmute yourself. We can't hear you. Yeah, we can hear you now. You've gone off again. Munguriak, you've gone off again. Now, in the interest of time, I've decided to go behind Zoom again and try and extend our time, because I'm seeing there's a lot of people have a lot of queries, but that also depends on our two panelists, Dr. Sam and Dr. Arnett. If you still have the time, maybe for another 1 hour after this to answer people's queries, there's a new link that I'm posting over, if that's okay with you too.
That's okay. That's okay. I can maybe start by answering a few of the questions that are picked from the chat.
Yeah.
One is giving 2 vaccines. So there is no scientific evidence yet to support giving getting the first jab as one vaccine and the second one as another vaccine. So there's no evidence to support that. So at the moment, the current recommendation for WHO is if you start with AstraZeneca as your first, the second should also be AstraZeneca. The second was about testing. So testing is, again, I'll go back to testing. Perhaps a number of people misunderstood me. So I said the current recommendation is to not test before you get a vaccine, except if you're sick, late, then, and you're going for your vaccine tomorrow, and today you're having fever, you're coughing, surely you must test, okay? You test, if you're negative, you get your vaccine. If you test and you're positive for COVID, then you have your care. And once you turn negative and the symptoms stop, you go for your vaccine. So I've not said test before every vaccine, no. I've only said only people who are sick should test so that they are managed, and then after that, get the vaccine. Otherwise, the rest of us, please just walk into the line and get the vaccine.
That's very clear.
Yeah, then the time from vaccine to protection is about 3 weeks. So if you get your first dose, it takes about 21 days, 2 to 3 weeks for your immunity to build, even the second one. So the vaccine has a period within which it works as it builds your immunity. And your full immunity by 3 weeks is up. Then there's a question about sexual intercourse after vaccination. There is no, after vaccination, you can do whatever you do routinely. There's nothing to change. No, don't stop breastfeeding, continue exercise, do whatever you do. There's no change for that. Then people with chronic.
Dr. Arnett, before you go further on that, there's a question that came up as well in my inbox. It was private. Somebody was asking if COVID-19 could be transmitted sexually, you know, like any other, since it is exchange of bodily fluids. But I thought about it, maybe in terms of exchanging saliva or something like that. Apart from that, is there any other way that COVID can be transmitted sexually?
Sexual intercourse, no. And I showed you very clearly the diagram, and I told you about the coughing, the diagram of spreading of cough. It's like TB, really. It's something that is in the lungs and you're coughing it out, okay?
That was very clear. And must I say, I really love the way you localized the explanation of how vaccines work. You know, if anybody has not understood this from Dr. Arnett's explanation, then nobody will explain anything to you in a much more clearer way. Right, Dr. Daga, you've been raising your hand for a very, very long time. Can you unmute yourself, please? John Odaga.
Okay, yeah, thank you very much, moderator and Annette Sam. No, I was taking note of the questions which were being asked also, but I think that, just a second. But I think that most of them have already been answered. Let me see. There's a question somebody asked, what happens if someone is vaccinated when exposed to the virus already? I don't know whether this is a situation where maybe somebody was exposed and has recovered and is negative, as Annette explained, or actually that you go for the vaccination when you are symptomatic, because we have received so many questions to this effect. And so my understanding is that going for the vaccination when already you are infected and showing symptoms in itself is not dangerous, because the body is being primed by the virus itself, but as well as by the vaccine. So I think I've had a couple of cases, colleagues who by the time they're going for the vaccination, they develop symptoms. And then one day later you discovered, oh, apparently they already had the infection. And they have been lucky for some reasons. So you could not say they have survived because they were vaccinated. Like it has been said, it takes like 2 to 4 weeks for the immunity to build. But the point is that the vaccine per se probably would not worsen your situation apart from the usual mild side effects. What happens if someone received the first vaccination dose? I think Dr. Annette has answered that, but I saw somewhere there is a benefit in receiving multiple vaccines. It's like deploying different types of forces in your body. You are better of fighting the different clans of these viruses that come disguising in different colors. However, for every particular vaccine, you need to receive the full dose, because there's no benefit in receiving half a dose of amoxicillin, then half a dose of the other antibodies, then half a dose of the other. So you're basically deploying so many ineffective forces. So for every vaccine that we choose to take as a country or an entity, we must receive the full dose. That's when it is fully effective. But there is no danger, but actually maybe beneficial to supposing later you have access to Pfizer, also take it, but take the full dose. What is the other one? Let me see, I think the other ones have been answered. Well, the issue is people raising the question of information overload, and someone calls it infodemic. This epidemic of false information, how do we manage? I think this is one of the reasons, one of the ways. So I think this discussion has been very good, and we hope we can continue having more of this to clarify things for people, so that we provide the right information for this. This is really about making informed choices as individuals. So we need to be able to provide correct information to people. If I got COVID after receiving my first jab and healed just before taking my second jab, do I go on? Yes. The idea is that you get the full jab. That is when you're fully protected. So yeah, that's what I wanted to add. Thank you.
Thank you so much, Dr. John Odaga. Munguriek, you've been up there. I don't know if this time your audio is working. Can you unmute yourself and say whatever is itching your throat? I hope it's not coronavirus. Right, still can hear us? Okay. Munguriek, can you unmute yourself?
Okay, I hope it's clear now.
I can hear you now. It would help, perhaps, maybe if you turn the video off, because I think it's affecting your bandwidth.
Okay. Let me be, okay.
We can still hear you. We have already seen your face, so don't worry about the video. Right, your sound has gone off again. Munguri, your sound has gone off again, and your video is still on. As you grapple with that, we'll come back to you. Jessica Draro, can you unmute yourself, please? Jessica Draro. Jessica. Right, Jessica is not responding. And Mongoriek's audio is still, we can't get you. Mongoriek, can you get us? No. This is a question for the doctors. There's a question that has come in my inbox. If one is vaccinated, can they still infect others?
Okay, I'll take that one. So the vaccine, like we've said, once we get to a state of herd immunity, of course, the infections are reduced. But as an individual, the vaccine doesn't say you won't get infected. You can still get infected, you can still infect others. But what it's protecting you from is dying. It protects you from getting severe and critical disease, such that if you get it, perhaps you'll get a very mild disease, or you might end up even being asymptomatic.
Thank you very much for that, Dr. Annette Alenyo. Beatrice Pachunega, you can unmute yourself. Maybe before Beatrice comes in, probably Dr. Sam wants to add something onto that. Dr. Sam.
Yes, yes. I will leave the other side part, which Annette has already answered, because it is true that when you are vaccinated, you still have some lesser risk of getting infected. And once you're infected, you can infect people. But remember, she also mentioned earlier, when we talk about the method of transmission, when you touch contaminated surfaces, you are vaccinated, probably you are protected, but you go around greeting people, you go around touching things and so on, and you don't sanitize your hands. You are going to take these things in your hand. You're going to touch door handles, you're going to touch other things which will be touched by other people. And in that way, you are actually transmitting. Apart from you having still the risk of being infected and being asymptomatic of having mild disease because of your vaccine, you still have the external transmission with your hand. And that's the essence of having hands washed or sanitized very frequently in between moments, short moments. So yes, that you still have to continue with those measures of protection. Thank you.
Thank you, Dr. Sam. Beatrice Pachunega, you can unmute yourself. David Rupin, I've recognized your presence. You will come in shortly. Same with Draro Jessica. You'll also come in shortly after David. Beatrice.
Hey, can you hear me, Ken?
Yes, I can. I
because
believe everybody else.
Telling me that the host is not allowing you to unmute.
Well, that is
nice.
technology for you. Please go ahead.
Okay, thanks. Dito Mira, I just want to thank you for this initiative once again. And I want to thank Dr. Sam and Dr. Lenyo very much for all the very insightful information they're sharing with us, including Dr. John Odaga. Mine is just to add a little bit onto what Dr. Sam said, not so much on the technical aspects of the virus or the vaccine, but to say that going forward, vaccination is going to become something that we all must go for. I want to share just a little bit with what we are doing here in the UN in New York. Many of you must have known that we've been on not working physically in the offices since March of last year. I've literally been working from home since March last year. But now on the 6th of July, we are being allowed to go back physically to work at the headquarters. However, only those who are vaccinated are being allowed physically. The UN is trying to avoid litigation measures to try and say people might sue them that they're being forced to vaccinate. So they're using very flowery language, saying that it would be nice if everybody could be vaccinated. All those who are vaccinated are free to come back to work from the 6th of July. Those who are not vaccinated are encouraged to get vaccinated or to continue wearing masks and observing SOPs in every place that they come to. So going forward, the vaccine hesitancy is something we need to really tackle in GN and in Uganda as well. Of course, I know for sure that apart from the fact that we've had very few vaccines sent to many developing countries, including Uganda, I also know that there's been the issue of vaccine hesitancy. So that's another thing that we need to really get out to our people, to tell them that vaccines are safe. And like all the doctors have said, it increases your chances of survival, because the death rate right now going on in Uganda is so alarming and so scary. So we need to tackle the aspect of vaccine hesitancy. And yes, I heard what Dr. Sam said. People are saying it's my right not to get immunized. But yes, it's also your right not to infect other people. So very soon, vaccines will become mandatory for people to appear in public spaces. So what happens if you're not immunized? So that's just what I wanted to share with you, Dr. Kennedy and team. Thank you.
Thank you very much, Beatrice. Hope you're keeping safe in New York as well. Before I bring in David Rupin, Dr. Daga, you wanted to say something to add on to what Dr. Sam and Dr. Annette had said. Please unmute yourself. Dr. Daga?
Yeah, no, the question of whether you'll get infected. Of course, a lot of people say, oh, no, what's the point of vaccinating when you can get infected? And I think Annette and Sam have explained that very, very well. So there's no vaccine that's like 100% effective, because that's a lot of the messages going around trying to undermine vaccination is a fact that even though you are vaccinated, you can still get the infection. The thing is, after the first dose, I think there's even another question to that effect. The level of protection that one gets after the first dose versus the second dose. Normally, the first dose is basically awareness, bringing awareness to the body that, oh, there's a prospective enemy coming. And the body reacts in a sort of lazy manner. So you get a bump. Maybe the protection can be 30%, but I think for AstraZeneca, it could be around 60% there. So which means that out of every 100 that you have vaccinated, there's still a very big chunk of those vaccinated who will not develop sufficient immunity to protect themselves. So normally second doses are like booster, and the body tends to be, already it has been primed. There's some LDUs employed, and they mobilize very quickly. So normally the second reaction tends to be maybe 3 or 4 times higher than the first time. And that's when you receive this, maybe 9 out of 100 that have been vaccinated are able to not even receive the infection. But 10 out of that 100 may receive the infection, even if you're fully. The only thing is that last time I was explaining to colleagues, I said, you're like a stealth bomber. You know, that American bomber system that it comes and strikes you. You're not even seeing it, you're not even hearing it. So many times when you are vaccinated, you go about your business as usual because you're not seriously sick. But in the process, you're passing it on to other people who may not have been vaccinated that have some underlying conditions. So yes, so the level of defense varies at those one.
Is that through osmosis? Please pardon my O-level biology.
No, it's a usual process because your body is now strong defensively, but you're still shedding out the virus.
Yes.
So it gets onto somebody who has not been vaccinated. And unfortunately, that person might be having other factors. And you see, they say this virus requires transport, is likely to arrive into your house on 2 legs through your relative, friends, and in-laws, and you don't know it, you are not aware. And then because you're not vaccinated, it gets you. And that is the unfortunate thing. And this is the reason why they say, even when you're vaccinated, keep on following the SOPs until we reach such a level where the majority of the population is vaccinated. And I'd call it herd immunity, but about maybe 85%. And that 85% target now, the number of people vaccinated is increasing. Initially, we were looking at those 18 years and above, but now we're considering maybe, rather, we're looking at 50 and above, but now we are considering also perhaps including those 18 to 49. So when you talk of 85% of the population, we need to look at that wider population. So until we get to that point, even if I'm fully vaccinated like I am, there's a possibility I can still get the virus, but then I don't feel so sick. When then I go and pass it on to somebody else who's not vaccinated, and that person will be in trouble. So that's what I wanted to add. Thank you.
Thank you very much, Dr. Daga. Dr. Julian and Draro Jessica, please don't get tired. We are still here. I'm happy to report and update you that we have the time. And that's provided our panelists, Dr. Sam and Dr. Annette, are still available, and the other team of doctors, like Dr. Odaga, are still around to answer questions. So, Draro Jessica, I'm hoping that this time your sound is going to work. Can you unmute yourself, please? Draro Jessica?
Hello?
Yeah, we can hear you at last.
Yes, thank you so much. Good evening, colleagues.
My apology, you've been there for a very long time, and I can see your hand was getting tired.
I'm always patient enough. Thank you so much. I'll just say that in Pakwach, you didn't get the data. That's right, but the truth is we have COVID. The home care are 56, and then 3 admissions and 1 death. But cumulatively, we have 79. And our people are trying to handle them. But my question is on the issue of RDT and PCR. There are cases where you find somebody's RDT is negative and PCR is positive. I just wanted to know how many days does it take for the RDT to be like positive? Because many of us depend on the RDT results. That's the only question I have. Thank you.
Thank you, Draru. Our doctors, Dr. Annette, Dr. Sam, Dr. Daga, one of you can just take it away. While as our doctors are organizing themselves to answer that question, I'll bring in Dr. Amos. You want to say something? Please go ahead. Dr. Amos, you can unmute yourself.
Thank you. I hope I'm audible enough.
Yeah.
Yeah, good evening, everybody. I'll answer Jessica's question, or attempt to answer. RDT should be, they're useful within the first 5 days of developing symptoms. Beyond 5 days, their reliability diminishes significantly. So if you're going to use that, you should not take in someone who has developed maybe 10 days after developing symptoms. And also, when you do PCR, you can detect you can detect the virus, and detecting the virus will help you to get the form which can replicate. That is the form which is the form of the virus which is able to get transmitted, because you can have the virus in your body. The longer it stays in your body, the lesser the chance that it will get transmitted.
I'm sorry, we're having a problem with the sound, I think. Dr. Amos, can you unmute yourself, please? Dr. Amos, can anybody hear me? Can anybody hear me? We're having a problem with the sound, I think. Right. Dr. Amos, can you unmute?
I can't. Hello?
I can hear you now.
Okay. What I
Sorry about
said
that.
was,
There was a bit of a mix-up with the system.
okay. The RDTs, the rapid tests, antigen tests are useful within the first 5 days of developing symptoms. That's when it's reliable. After 5 days, the reliability goes down. Then two, the PCR, where you detect the virus in the sample, can be used for two things. One, to detect that you have the virus, and also to detect whether that virus can be transmitted to another person. So the longer the virus stays in the body, the less the chance of it getting transmitted. That's why after 20 days, most likely it's more unlikely that the person who has the virus will have the type which can be transmitted to another person. All the same, because we don't know exactly when in one person the virus is still able to be transmitted and in the other one it's not, it cannot be transmitted, you still must protect others if you don't want to protect yourself by keeping the SOP, by maintaining the SOPs and also wearing masks, social distancing and wearing masks. I hope, Jessica, I answer your question about the timing of the RDT test.
Thank you so much, Dr. Amos. Dr. Sam?
Yeah, just maybe just to add to Dr. Amos, there is also the question of false negative with any of the tests. You can do, whether it is the RDT, but the RDT means rapid diagnostic test. And at the beginning, when this pandemic started, we were using the RDT, which would detect antibodies. So that it tests whether you have ever had the infection in your body. That type of RDT is now useless because even with the vaccine and the massive community infection, so many people have antibodies and they have recovered, or the vaccine is there, so it is useless. The one which is being used now is the one which detects the antigen, a substance which is actively present on the virus which is in the body. But the point is that whichever test you use, there is a certain level of false negativity. That's why sometimes some people have said the first test did not, especially during the first wave, people were complaining. The first test, I was negative. Now they have done this and they're claiming that I am positive. In fact, even if the samples were taken the same moment, but tested separately, there's a possibility that one can be negative, one can be positive because of that small chance of false negativity. And we have seen a number of people on whom the tests have been repeated and they remain negative. So in the end, what confirms are the other signs, especially, you remember Dr. Lenyo mentioned the chest x-rays when you're coughing. Many people who are even asymptomatic, when you do the scanning of the chest or the chest x-rays, you see certain, pictures like glass granules and so on in the lungs. And that's when people say, hey, actually this person is having COVID. But the test has been negative. You have done it 2-3 times. They are negative. But the x-ray or the scanning is showing it, that this is typically a COVID sign. So yes, Jessica, it will not be too surprising that you have done the test with one method and then the next time it is positive or even negative. Both are being negative, or with the same type of test repeated also being negative. Thank you.
Thank you, Dr. Sam. Onyai Pitua, you want to unmute yourself? Onyai Pitua. If you've gone off, I'm going to ask Dr. Amos Nyaturamo to come back since you've raised your hand up. You can unmute yourself and.
I think, thank you. I didn't have anything to add, only that my hand has refused to go down.
Let me put it down for you.
Okay, thank you.
There is God. Right. There's still a lot that we need to really talk about, especially in the chats. To the doctors, there's a question that came up. What happens if someone is asymptomatic and gets the vaccine? If someone is asymptomatic and they get the vaccine. Yes, Dr. Sam.
I have raised my hand to answer that question because my colleague and sister, Dr. Len, actually answered that question about 3 times.
It's still coming up.
It is still coming up, but she actually answered the question. I think even I also answered that question. Dr. Dagai has also answered that question. The point is going back to what the vaccines are and how they work. Dr. Lenyo told us, and we repeated, that the vaccines themselves don't cause any disease at all. So you are asymptomatic, you don't have any disease, but you have the virus in you. The vaccine itself is not going to cause a disease. It is a protein that has been generated either from the nucleus system, the RNA or DNA, or it is a deactivated virus, which is not going to cause any disease. So people who keep arguing that they need to be tested if they have the disease, they are asymptomatic, and then if you have seen people who have developed COVID, real COVID after vaccination, it is not because of the vaccine. It is true, the vaccine does not stop the process of the infection, which you already had before the vaccine. The vaccine will not stop it. Neither will the vaccine heighten the process of the infection. You will continue with your infection. If it is to remain asymptomatic, it will remain asymptomatic. If it is to progress into what I would call now stage 1, because stage 1 is asymptomatic. If it is to go into stage 2, which is mild case, and then to stage 3, which is moderate, and so on, it will continue. The thing is that, as Dr. Lenyo said, the vaccine will most likely start protecting you even from getting severe disease from around 2 weeks, 3 weeks, 4 weeks. So in that process, you will say, but I have got the vaccine. It's supposed to protect me from progressing into bad stage of the disease. Yes, it is supposed to. but it takes weeks to do that. So the vaccine, if you survive that particular episode of infection, the vaccine will now protect you from another episode. When you get it, it will protect you from going into a severe disease. That's it. But the vaccine itself, which you have got when you're asymptomatic, will not do anything negative to you, neither will it worsen your disease condition. And that's why you are not required to do any test. And there's nowhere in the world, not even in the US and so on, where they have all the resources, that they do routine testing of people who are going for vaccination. If you want to go and test yourself, but there's nobody who is telling you that you must routinely test yourself before being vaccinated, because the vaccine has nothing to do with the virus, which is inside you.
Thank you so much, Dr. Sam, for that clarification. Now, before I fire the next question, I just need to remind Munguriek that I recognize that you want to say something. So if you can unmute yourself and get quick with it, that would be really nice. You're online?
Am I clear?
Yeah.
Yes, thank you very much. Dr. Javuru and your team.
Although your sound is still not very clear, but we can hear you.
Am I now clear? Is it fine?
Yeah.
Hello.
Yeah, we can hear you.
Congratulations to Dr. Javuru and the team for this program. Condolences to the family of Onega. I'd like to be assisted on some two things. Like
your network is really bad.
To be network is bad.
Yeah, it's really
okay,
bad.
Oh no, I'm sorry.
Munguriek, what you can do is you can put
Yes,
inquiry in the chat. If we can hear your sound.
Okay, now let me inbox you my query.
Yeah, you can put it in the chat. We are reading through the chats and the doctors will respond to it. Okay, then. Thank you so much for that. Dr. Julian, you've been up there for a while. Can you unmute yourself, please?
Thank you very much.
You're welcome. Go ahead.
Can you get me? Yes. Thank you, our presenters, for this Zoom. It has been very helpful. My comment is on the community and especially those we are sending on home-based care. The issue has been there's no transparency in some of the cases. You find that someone knows they've tested positive, but they don't disclose to their family members. And even when you tell them this and this is supposed to be done, they don't disclose, and then business life continues as usual. Then you find that the family members are getting infected because they are also not being vigilant or not protecting themselves. So that brings a failure in the home-based care. And my encouragement is that if you get tested, this is not, we're encouraging the stigma on the disease. This is not any disease that should be really linked to a lot of shame, because as long as you're breathing, you're at risk of getting it. So people should make sure their family members are protected, disclose their status so they can also get some psychosocial support. And also to the community members, let us desist from creating unnecessary stigma. It shouldn't be there. If we are to handle this disease with stigma, then we are not going to go anywhere. Thank you.
Thank you so much for that, Dr. Julian. You know, you touched on a very, very important issue, especially the stigma surrounding COVID-19. This is not a disease that people go looking for. And when you get it, then people start laughing at you and saying, SION. No, you know, anybody can get this. So we need to be very empathetic to people who have got the disease, because anybody can get it. Going forward, we've got a few more questions, one of which is, how effective is it to vaccinate with more than one vaccine? In Aluru, we say apart chocolate. You know, does it fortify you more? Does it make you more, you know, resistant to COVID-19 if you vaccinate with more than one vaccine? You know, AstraZeneca, Johnson & Johnson, the Chinese one, Pfizer, name it. The other one is, has there been any case of somebody dying after they have been fully vaccinated? Over to you, our doctors. Yes, I can see Dr. Daga, you have your hand up already. You can unmute yourself.
What was the other? I had wanted to respond to a question earlier, which was raised by, the issue that Jessica raised, and which you have acknowledged that this is a very important point, the element of stigma. At the same time, I think we have reached a point where now people are openly sharing their experiences and mentioning that, we have this, we have that. Personally, many of you here on the forum knows that even in my house, I am living positively with kids who came back from school and they are positive. And it's not very easy. So you need to counsel the house. You need somebody else to counsel you, the head of the house. This is not very easy. Father Mungo Jakisa is here. He has been our international counselor of many people. But the point is that counseling is very, very critical, because enforcing that SOP within the house and making sure it is done in a sustainable way without the patient feeling maligned, marginalized, feeling very bad. So it takes a little bit of effort, but is other than the medications and the care, the technical side of things that Anna talked about, this psychosocial support is not an easy thing. We can just talk about it, but it's not an easy thing. And it's not like something that is going to be enforced in 1 or 2 days. You have to sustain that behavior change, that discipline, even within the house for a period of time. The relatives will be coming over to you, like so COVID might arrive on 2 legs. The relatives who are coming and you don't want them to come in, they think you don't like them, when actually you are trying to help them. So I think that's really a very important element, but actually equally very difficult. I think the issue of the other one was what? Can you apart chocolate? I think I explained that earlier on, right?
The other one was can you have more than one vaccine?
No, that was the point I was trying to explain. Maybe it did not come out well. But I think the main issue is that once you've chosen a certain vaccine, get the full dose instead of getting half here, half there. Okay. And I said it is like deploying so many different types of troops. Each of them is incompetent. They will not help you. So, but if you have AstraZeneca, make sure you have the full dose of AstraZeneca. But at least as far as what I have come across in terms of evidence, there is no danger in having more than one type of vaccine. You can have AstraZeneca, full dose. Then later, if you have chance to get Pfizer, and you also add it, full dose, it doesn't do any harm. Actually, there's a phenomenon where they think it is even better because this virus wears many colors. It can come today in black coats. The next time is coming in a yellow fatigue. So when you have different vaccines, your body is better prepared for any forms of disguise. But there's no danger. The point is that don't take Kuditima Abila of AstraZeneca and then Abila of Pfizer. You're wasting time.
Bila pakalanga, Thank you so much, Dr. Daga. Dr. Sam, you want to come in?
Yeah, I think I will request that, I don't know, Annette is still there.
Yeah.
I will request that we comment with Annette also on these questions, particularly, and Annette will also comment on the multiple vaccine. Then I will also comment as on the question of somebody dying after the vaccine. First of all, taking from what Dr. Daka is saying, there is no danger in having two vaccines or more. I think the issue is not just about danger. The issue is about need. Do you really need to have that? And we may argue that because the disease is coming in multiple ways and so on. One evidence which is very clear is that, and I think Annette talked about it. One evidence which is very clear is that whichever form the disease come in, you might get infected because, whichever vaccine you have got, you might still get infected because you are not going to be protected 100%. But whichever variant, at least of now, whichever variant you get, there is a very increased chance of you not progressing into moderate, severe, or critical disease when you are vaccinated with one type of vaccine. From a policy perspective, I just want now to put my policy hat. From a policy perspective, I think if we say, let people now get multiple vaccines, we have got AstraZeneca, next time we get the Pfizer and Moderna, which are not very easy to take care of as well. And then somebody gets this one, comes to get that one. We are being selfish to Ugandans. We need to get the opportunity for Ugandans all to be effectively or fully vaccinated with at least one type of vaccine. And that's why the other time at first we said, let's try to let every Ugandan who was in the high risk category to get at least the first dose. And now we are saying, let us at least let them complete that. And then when we reach the level where the Americans are beginning to vaccinate the teenagers and so on, we can now say, well, you can now start getting as many as you want or as many as you can pay for and so on. So from a policy perspective, it is better for us at the moment to stay there. But I will leave my sister and colleague, Annette, to comment on, because she really answered that question at the beginning. Number two, dying after vaccination. I will answer it from, again, this question has been answered. Dr. Annette answered it, I also answered it. But we are used to this. You answer and people ask the same question at the end of it. People will ask the same questions even after. So the next time we make the presentation, these same questions will come and we should not get tired.
Absolutely.
We will explaining.
Absolutely.
So the thing is that, first of all, let us assume you have been vaccinated today, but you were infected yesterday, or you get infected tomorrow, because the vaccine has not yet even lasted a week. And we have just said that the vaccine will start protecting you from around 2 weeks, 3 weeks, 4 weeks. So tomorrow you get infected, or the next 4 days you get infected. That vaccine, which has not yet started, your body has not yet started producing antibody as a result of, will not protect you from progressing to moderate, severe, critical disease. So yes, you can die, especially if you delay in reporting for treatment. And that's why Dr. Lenyo was saying at the beginning, let us try to have contacts of people who can call, so that at the earliest sign that somebody is sick, and by the way, we need to have very high index of suspicion. I have seen on some WhatsApp groups, people are saying, this is a dongi machon, this is a dongi machon. Dr. Annette told you that there are 7 different members of the COVID family. 3 of them are causing us problems. There are the others we have heard actually, which have been causing us mild illnesses like what we call a dongi, ordinary flu. They are there. But these ones here, Makutuoke, the three of them are causing us problem. And now the seventh one, the COVID-19, is causing us the biggest problem. So,
Dr. Sam,
yes,
there's a question here which I think would actually tie in within what you're trying to say. So
yeah.
if you could just answer it as well as you go on. This person is saying, what medicine should I take if I think I'm negative, but I need to protect myself, you know, but I haven't tested yet. What medicine should I take to protect myself from getting COVID?
Okay, I will come to that. Thank you. So the point is that right now, in ordinary times, if you got flu, if you got a dongi, you would take it easy. But in current moment, once you get what you call a dongi, you must have a very high index of suspicion. You must not take it for a joke before it turns out into something else. You must go and get tested straight away. So you can get you can get something tomorrow which starts like a dongi, but it may actually be COVID, and you will die. And if you had the infection already, even before your vaccination, the vaccination is not going to stop the process of the virus itself yet, because again, as I said, you have just got the vaccine. So the people who have died after vaccination have not died due to the vaccination, because the vaccination itself is not causing the disease. However, Dr. Lenyo did mention among people who should not get the vaccines, she said if you have had a history of severe allergic reaction to vaccines or components of the vaccine or any vaccine, if you have had severe allergic reaction, in that case, you are very likely also to get severe allergic reaction that may kill you. And in those are the rare cases where the vaccine would have killed you. But you would have been asked whether because all of us have been vaccinated in the past, you had been asked, did you have severe or do you have allergy or severe reaction to any vaccine in the past? Or if you got the first dose, did you have severe reaction to it which was managed? If you hide, you don't tell, then you're going to have a reaction after you have got the vaccine and gone home alone somewhere. That's where you will be in trouble. Now, if you are not vaccinated or you are asymptomatic, you don't know, is there any drug that you can take to prevent it? Again, this question has been answered. There is no medicine or antiviral drug that you're going to be taking to prevent the virus from getting you. I think it is very clear from the presentation that Dr. Annette emphasized very much that we need to keep ourselves healthy. Now, when you are healthy, first of all, if you are infected by anything, whether bacteria or virus, it makes your body response in defense stronger. And that's why, for example, when you get flu, when you are very exhausted, the ordinary flu, when you have been very exhausted, you are fatigued, you are depressed, you are stressed, when you get the flu tortures you a lot. But if you get flu when you have been resting, you have been eating well, you have been eating a lot of fruits, you have been taking fluids, your body is strong, the flu will not harass you much. So when you are taking a lot of fruits, you are taking a lot of these vitamins, your body is strong, your body responds better. And in fact, you are likely also to remain asymptomatic if the virus enters you, and then your body will fight it. It will go off by itself because it has found your body strong. But there's no medicine that you should be taking. And I think I remember he warned against people who are buying a lot of antibiotics, amoxicillin, and all sorts of drugs, ivermectin, and so on and so forth. She warned against them because if you start swallowing these drugs that you're protecting yourself, the day the virus will reach you will when you have even run out of stock of this drug. That's when the virus might reach you. But also, And in that period, all the drugs you have been taking will have done actually no work. There was nothing it was treating. You are simply depleting stock for nothing. And then at the same time, you will be damaging your liver, you'll be damaging your kidneys and so on. Now, let me go back maybe to the first thing also again about death. One of the things that people have been saying is that when you are vaccinated, that in some countries people have developed blood clots, and these blood clots have killed people because of vaccination and so on. Two facts. The first fact is that in extremely rare case, I don't remember whether it is 4 in a million or 0.4 in a million. I don't remember the figures here very well, so let me be excused, but I think it is something to do with 4, either 4 or 0.4 in a million people who are vaccinated, developed some clots in those cases. But even when we followed them, they found that actually a lot of these people already had predispositions to developing clots. So it was not just the vaccine. The second fact is that many people die in COVID because of clots caused by the disease itself. So it is a much, much, much bigger problem having clots which is not just mild, but which will kill you when you get the COVID disease itself. Because as I explained earlier, it's going to attack your blood vessels, the inner lining of the blood vessels, which will become rough. Blood flow within the blood vessels will become sluggish. There will be blood elements sticking on the walls, and therefore you're going to end up having blood clots in your blood vessels. So sooner or later, these blood clots will be dislodged. They go into your lungs, you get embolism, they go into your brain, or these blood clots will go and block blood flow to certain parts of your body, your pancreas, your liver, your kidneys. You're going to end up with yellow eyes, and so on, because of the blood clots due to the COVID. So blood clot is taking place every day, even here, due to COVID itself, not due to vaccine. Thank you.
Thank you, Dr. Sam. Before you go, there is a question which is rather on the policy side of things. Somebody's asking why Uganda does not recognize test results from some other countries like TZ. I know, it's a bit of a technical policy issue here.
The problem is that you are talking of TZ, and that's why I'm laughing. You know,
it is something that needs to be researched.
When you create doubt about yourself, people will, and then when you start behaving, people will want to cross-check and build statistics. That really now you are clean.
So that goes back to how TZ handled COVID when it first came on our shows, isn't it?
Exactly. So people will say, are they really now telling us the truth? So when they build statistics and build trust in you, they start trusting everything.
I think it cuts across as well, the way some Ugandans have responded to government's messaging about COVID-19. The way government handled it when it first came in, it created some doubts as well. But I'm glad that the message is now beginning to sink. You know, people are realizing that COVID is not a political hoax. It's real because it's killing people. So those are some of the things that we need to learn.
Yeah, and I think for me, I think the way the government handled it itself did not have a problem. What the problem was behaviors of the people, and it came at a wrong time at the height of politics in Uganda.
Yes.
And people who are within the mix of the politics themselves,
they hijacked it.
They acted in certain ways. Otherwise, in terms of the technical approach, I think there are only a few technical hitches that we know we might not talk about here. But I think generally it was okay.
Right. We got about 15 more minutes to go. And Dr. Annette.
I don't know whether Dr. Lenyo has something to add on.
Yeah, that is why I'm coming in, asking
yeah.
if Dr. Annette has anything more to add.
Thank you very much, my senior colleague, Dr. Sam. I think he has explained everything well. I'll just respond to the issue on multiple vaccines. So, of course, if you look at the opportunity to have multiple vaccines, from a policy perspective and a public health perspective, it would make more sense that you can get any vaccine anytime and it should be okay. And if that is possible, then it would make more people be vaccinated. However, there's of course the science of it regarding mixing, because the different vaccines work in different ways. And there is of course, the potential to have some immunological responses that may or may not be desirable. So I know that at the moment, there is no current recommendation by the WHO SAGE. However, there are studies that are being done. I think in the UK, they're doing the COMCOV study as one of the many studies that is being done to see if you can give people one initial vaccine and then a booster dose as a different type. So the studies are being done on that. And once the science comes out and it is safe and we can be more confident in making this recommendation, then it will be made. But as it is now, there is no current recommendation that this can be done.
Thank you very much, Dr. Annette. And I think we are coming towards the end of this. But before we wrap up, I was wondering if the president of FDGN is available, Mr. Odongo Emilio. Are you with us? Mr. Emilio? Mr. Odongo Emilio, are you with us? Well, if you're not, I just want to give a final remark about today's discussion. It has been very rich, very informative. There's a lot that we have picked up from our doctors. You know, it serves us well that we have very knowledgeable people at the forefront of fighting COVID-19. One of the things that I see that is really creating a lot of confusion in the communities is the issue of misinformation. And the biggest vehicle of this is social media. We really need to be on our guard, the kind of information that we consume on social media, especially the things that we share on WhatsApp. Some of this information comes from very unverified sources. There are people out there who enjoy creating panic. There are people who enjoy creating confusion. So when you get some of this information, you really need to be on alert. Ask a few questions before you share them, because there are other people out there who really take whatever you're sharing as the gospel truth. Based on your position in society. Secondly, based on the level of knowledge that they perceive you have. So if you share something, they'll just take it and say, this is the truth. It came from Kennedy. It came from Dr. Sam. No, it came from Dr. Julian. It came from Mongoriek. It came from Dr. Amos. They take it as the gospel truth. So we have to be very careful in this period, especially the things that we share on WhatsApp, especially. Most of the information are unverified. I won't say much about that. We've been engaging with people, especially on our Forum for Development of Greater Nebi. We've been telling people some of these things, ignore them. Don't share them. If they don't make any sense to you, don't share them. When you do that, you would have helped a lot in the process of protecting the community against the spread of this pandemic, this virus. I want to thank everybody. Most especially, I want to thank Dr. Sam and Dr. Annette Alenyo for your very, very rich presentations. This idea came from the two of you, to be honest, under the auspices of Forum for Development of Greater Navy. We want to see more of this. If there are any more questions coming up, always send them to us on the forum. You got my contacts, you got Dr. Sam's contact. We can always reconvene and have another discussion. Like we always say in Forum for Greater Development in Navy, Pimongo Mandongongomwa. Thank you so much. We still got a few more minutes, so if anybody else wants to add more on what I've said, you're most welcome. Yes, Dr. Daga, you can unmute yourself.
No, I didn't have anything to say. I was just clapping my hands. I think that was some old hand.
To me, it looked like you raised your hands up and wanted to say something. That's all right. That's all right. Other than that, thank you so much. Have a good evening, everybody. And keep safe. Wash your hands. Wear your masks. Stay away from people. You're just protecting everybody. Then let me share the talk. You know that you don't always have to be with to show you kungati. You know, you can always do it in your own privacy. You know, we shall all organize massive funerals. Me commemorating the one we have lost. On a final note, I would like to ask all of us to remember those we have lost already in this pandemic. We're having fresh deaths every day. May their soul rest in eternal peace. For those of us who are still alive, we are praying for God's protection. And for those who have lost their loved ones, we pray for God to comfort you with his love and kindness. Have a good evening, everyone.